Hello there, I am Chelsea Busher and I'm going to be talking about the mental health crisis among LGBTQ plus youth community. This hits home for me because I work with this community every day working in a school district, so I'm excited to talk about it. Mental health disparities. The LGBTQ plus youth experience higher rates of depression, anxiety, and suicidal ideation than heterosexual and cisgendered peers. So that would be 40% of the LGBTQ plus community considered suicide, within 29 actually attempting suicide. And I really appreciate the visual here. Personal stories and quotes. So these are ones that I kind of heard myself personally and the ones that I've researched. So I felt like no one understood me and I couldn't see a way out. Every day was a battle with my own mind and I didn't have anyone to talk to. So again, just us as social workers, really making sure we are those voices for those people. There is a lack of mental health services, so there is a shortage of specialized mental health services for the LGBTQ plus youth community. There is general mental health professionals, often those that they lack that sensitivity, providing them for the LGBTQ plus. There's an impact of stigma and discrimination on mental well-being. So again, just that initial stigma and discrimination, whether it be from your family, peers, or any institutions, those are major contributors to mental health issues, especially in the face of a LGBTQ plus youth who get that rejection and bullying, harassment, no matter where it is. Mental health resources available versus the demand. So there are mental health resources that cater specifically to the LGBTQ plus community and are in short supply. There's a lot of long wait lists, overworked professionals, and insufficient funding contribute to unmet needs. So I always like to think of imagine having a society where the LGBTQ plus youth have access to affirming mental health care. So this would just mean the world to especially what my job role is now. There are safe spaces in schools and communities. So me in particular, I am a social worker in a school district. So I want to create that environment where LGBTQ plus youth feel physically and emotionally safe. There I want there to be collaboration between mental health providers and LGBTQ plus advocacy groups. So again, just supporting that mental health need wherever it may be with that youth and wherever the need is. Successfully mental health programs that are specifically tailored to the LGBTQ plus youth. So I think that would, what stood out to me was the Trevor Project. I talk about them a lot to my LGBTQ plus youth in my school district and what programs they offer. The representation and support in media for like the public spaces. So I liked the visual here because I'm a big Schitt's Creek person, and Orange is the New Black was like my first show that really got me interested in LGBTQ plus, really expressing the openness in the public view. So I would like to see there be proposals for school policy changes to include more tailored mental health programs for LGBTQ plus youth, whether that be advocacy for policies, to have changes, certain programs, incorporating all of these kind of supports that I have in this visual here. Obviously, there would be funding needs, so increasing funding. I know my job roles, especially social workers, are on the rise in my area in Missouri, so definitely finding that funding wherever the state needs are. Also, the legal protections and discriminations I feel like is super important, especially when you are working with the families as well. Making sure that there's good partnerships and strong connections and relationships with the community aspect of it. So, collaborating with those community workers too. Again, just making sure that we're advocating for the mental health and those parity laws, especially when we kind of get into the funding and advocacy part. Making sure that the culture responsiveness is within the youth program. So, social work, we really value those demands. And again, just kind of considering the race, ethnicity, gender identity, and socioeconomic backgrounds of these families. Again, just kind of looking at the social justices and making sure that we're empowering these young minds because this is a very sensitive topic, but this world is changing and growing. Again, I just really want to see the collaboration with LGBTQ plus and the communities to really ensure that they are feeling safe, whether that be in a school setting, in the community setting, to where we can create successful human beings and adults. Thank you.